I am Tisha Nuevo from BSN11G, and today video I am going to perform parenteral drug administration such as the intradermal, subcutaneous, and the intramuscular injections. So this demonstration is a medication that enters the body by injection through the tissue in the circulatory system. First, parenteral medication in intradermal. Check the doctor's order on the patient chart to ensure the medication of the client. Prior to the conduct of the procedure, first thing to do is to check the doctor's order on the patient's medication administration record. Next, performs hand hygiene and observes appropriate infection prevention procedures to protect myself from infection and spread of microorganisms. Next is to prepare the medication. Of course, we need to have syringes. I have the tuberculin syringe, which is ideal for the skin test for the intradermal injections. And I also have insulin syringe for subcutaneous injection and a 23 gauge syringe for intramuscular injections. And the aspirating needle, which is I use to draw the medication from the vial, and the sterile water vial and the ampule serve as the medication in this demonstration. I also have dry cotton balls and soft cotton balls with alcohol of 70%. And forceps. And the most important is that I have the waste receptacles here. This is where I will dispose the used needles and syringes. So to prepare the medication in the intradermal injection, first thing to do is that we need to open the tuberculin syringe, open the sterile package only, touch the barrel and the plunger to avoid contaminating the needle. Then remove the cap and connect the syringe, the tuberculin, into the aspirating needle. And we also have to open the package of the vial package device that connects the barrel. In the aspirating needle, we need to secure it. Then set aside. Then open the medication vial and clean the rubber seal using soft cotton balls and 70% alcohol. And then uncuff the syringe that is injected into the vial. After that, make an air into the syringe. Then invert the vial and then draw the exact amount of the medication needed. Now, if ever the bubble air is trapped inside the syringe, we can tap the barrel. Now, we'll have to remove this aspirating needle and place it with the right size needle that will be used in the actual administration of medication. Then replace it. Now, discard the aspirating needle in the medication box. Then, in the medication ticket, place the name of the drug and the dosage so that we cannot forget it. Prior to performing the procedure, introduce self and verify client's identity using agency protocol. Explain the procedure to the client and how he or she can participate during the procedure. To know if the assigned patient to use client using the two common identifiers, which are the name and the birthday. And so that the patient will gonna know what happened during the assessment and you should establish a good rapport. Good day, ma'am. I am Tisha Nuevo, your center for today. May I see your reason, please? Please say your birthday and birthday, please. Okay, and how would you like me to call you? Okay, Irene. And do you have any concerns or clarifications? Okay. And if you have some questions and concerns, don't hesitate to raise it, okay? Okay. So by the way, the procedure that I will be doing is that I am going to administer medication through intradermal injection so I'm gonna administering the medication using the injection and I'm going to impale it through your hands, okay? Okay. Reminder that to apply clean gloves to reduce the risk exposure to the microorganisms and other infections. Arrange the medication on the card on the hypodermic tray with the corresponding drug so that we can prevent the confusions later on. Choose an injection site free if the discoloration. Select the site 3 to 4 fingers widths below of the anticubital space and 1 hand above the wrist. Okay. Injection site needed to be free from abnormalities that interfere with the medication absorption. Position the client's arm so that his elbow and the forearm are supported in a flat surface to reduce strain on the muscle and minimize injection discomfort. Apply clean gloves, which is I already applied it, and use an antiseptic swab to clean the site, beginning at the center in a circular motion outward about 2 inches or 5 centimeters. Mechanical action of the swab removes the secretions containing microorganisms. Remove the cap and hold the syringe between the thumb and the forefinger of the dominant hand with the bevel of the needle pointing up. Preventing needle from touching sides of cap prevents contamination. Stretch the skin, tongue, and injection site by pulling gently with the thumb and the forefinger and the non-dominant hand. Needle presses tight more skin easily. Pull the needle very close to the patient's skin. Insert it slowly at 5 to 15 degree angle until you feel the resistance advance in the needle up to the epidermis about 1.1/8 inches or 3 millimeters. Ensure that the needle tip is in dermis. You can obtain an accurate result if you do not inject the needle on the correct angle in depth. Slowly inject the medication and feel the resistance until you see a blood that resembles a mosquito bite will appear on the patient's skin. Slow injection minimizes discomfort at site. Dermal layer is tight and does not expand easily when you inject solutions. Withdraw the needle at the same angle when inserted and pat dry cotton ball. Do not massage the area. Encircle the wheel with a blue or black ball pen and instruct the patient to not rub the wheel or erase the mark, so that the patient will know that in that area is not allowed to rub or erase. Okay, I will going to have a circle mark here in your arm and do not erase it, okay? Assist the patient to a comfortable position, indicate the site and due time for reading, so that the patient will free from uncomfortable and indicate the time and the site so that the physician will know what time you assess and what site you assess the assessment. Okay, are you comfortable with that position? Okay. Don't recap use needle. Discard needle and syringe to an appropriate receptacle. Wash hands and document the procedure and interpret the results after 30 minutes. Used needles need to be placed in a sharp disposal containers without recapping. Also, we need to dispose it properly to avoid injure people and spread infections that cause serious health conditions. So I'm going to discard it. So okay, do you feel any pain in your hands? Okay. It means you don't have any allergies from your medication. And it's also all good and normal. Subcutaneous injection. Repeat the procedure from step 1 to 4 to be able to do the subcutaneous injection procedure properly. And the procedure is still the same from step 1 to 4. So, okay, ma'am, I'm patient Gregor. You see return for today. When I see this one, please. Please take your computing and birthday, please. Okay, how would you like me to call you? Okay, you have any questions or clarifications? Okay. And if you have any questions or clarifications, don't hesitate to raise it, okay? Okay. So by the way, the procedure that I will be doing is that I'm going to administer the administration through your subcutaneous injection. So I'm gonna administer the medication using the injection and inhale it with your skin, okay? Okay. Perform hand hygiene and observe appropriate infection prevention procedures. To protect myself from infection and spread of microorganisms. Reminder to apply clean gloves to reduce the risk of exposure to the microorganisms and other infections. Arrange the medication card on the hypodermic tray with responding glove so that we can prevent the confusions later on. So as you can see, I already arranged it. Discuss with the patient the purpose of each medication, its action, and its possible adverse effect. Allow the patient to ask questions and find out the last injection was given, so that the patient will know what medication will be given to them and what is the purpose of it and possible effect. Also, to be able to answer the patient queries in their minds, we will allow them to raise any questions or clarifications. Determine the site which you will use. Keep patient bed linen and expose only the potential injection site, inspecting the area for bruising, inflammation, and edema. Injection site needs to be free from bruising, inflammation, and edema that interfere with medication absorption. Okay? Palpate the site and avoid any area that is tender to make sure you have the right size needle. Use the thumb and the forefinger to grasp the thin fold of tissue that injection site. Measure the fold from top to bottom and check to ensure that needle is about half along. The decision to create a skin fold is based on the nurse's assessment of the patient and the needle length used. Pinching is advised for the thinner patients. Apply clean gloves. Clean the site with the antiseptic swab in a circular motion starting from the center to outward. Pathogens from the skin can be forced into the tissues by needle. Allowing the skin to dry prevents introducing alcohol into the tissue, which can be irritating and uncomfortable. Insert the needle quickly and firmly at 45 to 90-degree angle. Release the pinch skin, rest your non-dominant hand on the patient. Inserting quickly causes less pain to the patient. Subcutaneous tissue is abundant in well-nourished, well-hydrated people. For patients with little subcutaneous tissue, it is best to insert the needle at 45-degree angle. Move your dominant hand at the end of the plunger and slowly inject the medication over the several seconds. Retain your grasp in the to keep it still. Keeping the needle steady helps the needle in place. Quickly withdraw the needle. Quickly withdraw the needle and place a sock or rust spot on the side and apply gentle pressure but don't massage. Withdrawing at the same time angle prevents tissue damage and increases the pain in the injection site. Massage is not necessary and can damage underlying tissue. Place the patient in a comfortable position and document the procedure record, the time, amount of the drugs on the medication sheet. Timely document ensures patient safety so that the physician also knows through the records what time and the amount of drug you administered. Okay, are you comfortable with that position? Intramuscular injection. Repeat procedure from step 1 to 4 to be able to do the intramuscular injection procedure properly, and the procedure is still the same from step 1 to 4. Okay, ma'am, I am patient Rebo, you submit this for today. When I see your response, please state your computing birthday, please. And I this, okay, and how would you like me to call you? Okay, I mean, if you have any questions or clarifications. Okay, and if you have any concerns or clarifications, don't hesitate to raise it, okay? Okay. So by the way, the procedure that I will be doing to you is that I'm going to administer the medication through your intramuscular injection. So I'm gonna administer medication through the injection and into your skin, okay? Okay. Perform hand hygiene and observe the appropriate infection prevention procedure to protect myself from infection and spread of microorganisms. Reminder to apply clean gloves to reduce disease exposure to the microorganisms and other infections. Arrange the medication card on the hypodermic tray with the corresponding drug so that we can prevent applications later on. Select an appropriate site for the injections. Maltus lateral in the deltoid muscle are possible site for IM injection. This prepares the patient for the injection. Examine the integrity of the patient muscle mass and palpate the muscle area of the tenderness are suitable for injection site. Choose a site that is free from pain, infection, ablations, or necrosis. Inspect the area for bruising, inflammation, and edema. If the skin shows bruises or inflammation, use the other site. Injection site needs to be free from bruises and or inflammation that is interfere with the medication absorption. Help the patient to find a comfortable position that will accommodate the injection site you've chosen. Expose only the portion of the body so that the patient will be comfortable while doing the assessment, and some body parts are also needs to be confidential. Are you comfortable in it here? If I inject your arms here. Okay. Apply clean gloves and use anatomical landmarks to find the site again. For perigluteal injection, place the heel of your hand over the greater trochanter of the patient's hip with the wrist almost perpendicular to the femur. Point the thumb towards the patient's groin, point the index finger to the anterior superior iliac spine, and extend the middle finger back along the iliac crest towards the buttocks. The index finger, middle finger, and the iliac crest form a AB-shaped triangle. The injection site is the center of the triangle. The site involves the using the gluteus medius and the minimus muscle and is the safest injection site for the adults and children. The site provides the greatest thickness and gluteal muscles, is free from penetrating nerves and blood vessels, and has a thin layer of fat. Disinfect the injection site in a circular pattern from the inner to the outer about 2 inches. Allowing the site to dry prevents staining during injection. Hold the gauze pad between the third and the fourth finger of the non-dominant hand. This allows for easy access to dry gauze after injection. Remove the needle cap by pulling it straight off. Hold the syringe with the thumb and the forefinger of your non-dominant hand as you hold in the dart. This prevents the needle from touching side and the cap and prevent contamination. Place your ulnar side of the non-dominant hand just below the injection site and pull the patient's skin laterally about 1 to 1 and 1/2 inches. Hold the position until you inserted the needle. Then, if the patient has a little muscle mass, grasp the body of the muscle between your thumb and the forefinger with your non-dominant hand. Quickly press the muscle at 90-degree angle to the skin, continuing to pull the skin down with your non-dominant hand. Insert the needle with a dart-like motion movement of the needle. Once injected, can cause additional discomfort for the patient. Aspirate the syringe by pinning back the plunger and the non-dominant hand. If a blood appears up appears you're not in the muscle. Remove the discard needle and the syringe and start over if no blood appears. Because the injection sites recommended for immunizations do not contain large vessels, blood vessels, aspiration is necessary when immunizing. Inject the medication slowly at the rate of 1 ml at 10 seconds. Wait 10 seconds. Simply withdraw the needle. Slow injection minimizes discomfort at the site, withdrawing slowly at the same angle as insertion minimizes discomfort to the patient and damage to the tissue. Release the skin in place a gas pad on the site. Apply a gentle pressure but don't massage the area. Covering prevents infection in the injection site. Massage is not necessary, can damage underlying tissue. Place patient in a comfortable position and document the procedure. So are you comfortable with the position, ma'am? Document the medication time, route, site, date of administration, and the effect of the medication, any adverse effects, unexpected outcomes, and any inadvertent applied.